Good evening, friends. You're most welcome to Think Eyes channel. Today we are going to discuss practicing anthropology and practicing anthropology in health. And our topic is the cultural interpretationist perspective. This is also called the symbolic interactionist approach. This approach focuses on the social and cultural construction of health, illness, and disease. According to this theory, illnesses and health are not just things that exist out there, they are productions of the complex social interactions, and health and illness are highly shaped by the manner in which people as actors give meanings to them and how the actors respond to them in socio-culturally sanctioned ways. Jiri Hun 2001. Next heading, the biomedical perspective. The biomedical perspective incorporates the biomedical theory in which patients are assumed to be passive recipients of doctors' instructions. Treatment is focused on the patient's body as health or disease is traced back to biomedical causes such as bacteria or viruses. This biomedical theory has recently been integrated into a larger biopsychosocial-environmental theory, which incorporates the wider socio-environmental context. However, this theory is not located strictly within the biomedical approach, but it is pertinent to note here that assuming patients as passive recipients while focusing on biomedical factors may create certain limitations in the study of medication. This is due to the fact that patients are generally active decision makers and we cannot expect them to merely receive and follow instruction passively or without any qualms. From whatever has been discussed above, it is quite obvious that ignoring factors like patients' perspective of their own illness, the psychosocial influences, the beliefs regarding acceptance or rejections of curative measures, coupled with the impacts of socio-economic environment on health behavior, has been a fundamental limitation of this theory. Behavioral perspective. This perspective incorporates behavioral learning theory (BLT), which is focused on the environment and the teachings of skill to manage adherence. The main focus is to understand how behavior is influenced by the use of the principles of antecedents and consequences. In simple terms, it implies that antecedents, which are either internal thoughts or external environmental cues, and consequences, which may be punishments or rewards or for behavior, are the variables which will affect or influence the probability of a patient following a specific behavior. BLT, behavioral learning theory, has been critiqued for lacking an individualized approach and for not considering less conscious influences on behavior which are not linked to immediate rewards. These influences include, for example, past behavior habits or lack of acceptance of a diagnosis. The theory also is limited as it focuses on external influences on behavior. It is therefore necessary for program planners to consider carefully individuals' perception of appropriate rewards before using such theory for implementation. Communication perspective. We are all aware that in any kind of patient practitioner relationship and communication plays a vital role. It is often referred as the cornerstone in such a relationship. The communication perspective is an approach based on the notion that communication needs to be clear and comprehensible to be effective. It implies that patient education and good healthcare worker communication skills ensure an improved provider client communication, which will further enhance medical adherence. Communication interventions are also typically restricted to provider client interaction, and additional social or financial support may thus be required. Communication perspective. We are all aware that in any kind of patient practitioner relationship, and communication plays a vital role. It is often referred as the cornerstone in such a relationship. The communication perspective is an approach based on the notion that communication needs to be clear and comprehensible to be effective. It implies that patient education and good health care, worker communication skills, ensures an improved provider client communication, which will further enhance medical adherence. Communication interventions are also typically restricted to provider client interactions, and additional social or financial support may thus be required. Cognitive perspective. The cognitive perspective includes theories such as the health belief model HBM, social cognitive theory SCT, the theories of reasoned sanction, reasoned action, theories of reasoned action TRA, and the planned behavior TPB, theories of planned behavior TPB, and the protection motivation theory PMT. These theories are based on the assumption that attitudes and beliefs, as well as expectation of future events and outcomes, are major determinants of health related behavior, and therefore they focuses on cognitive variables as part of behavior change. These theories propose that in view of the presence of various alternatives, individuals have a tendency to choose or select the actions that will ensure, in all probability, a positive outcome. Health belief model. The health belief model HBM views health behavior change as based on a rational appraisal of the balance between the barriers to and benefits of actions. According to this model, the perceived seriousness of and susceptibility to a disease influence individuals' perceived threat of disease. Similarly, perceived benefits and perceived barriers influence perceptions of the effectiveness of health behavior. Munro et al. 2007. The protection motivation theory. According to this theory, behavior change may be achieved by appealing to an individual's fear. Three components of fear arousal are postulated: the magnitude of harm of a depicted event, the probability of the event's occurrence, and the efficacy of the protective response. These components tend to affect the health behavior of the individual. Munro et al. 2007. Socio-cognitive theory. This theory evolved from social learning theory and may be the most comprehensive theory of behavior change development thus far. It posits a multifaceted causal structure in the regulation of human motivation, action, and well-being, and offers both predictors of adherence and guidelines for its promotion. Munro et al. 2007. Theory of planned behavior and the theory of reasoned action. The theory of reasoned action assumes that most socially relevant behaviors are under volitional control, and that a person's intention to perform a particular behavior is both the immediate determinant and the single best predictor of the behavior. Munro et al. 2007. Information motivation behavioral skills IMB theory. This theory was developed to promote contraceptives use and prevent HIV transmission. IMB, information motivation behavioral skills, was constructed to be conceptually based. It has since been tailored specifically to designing interventions to promote adherence to. This theory focuses on three components that results in behavioral change: information, motivation, and behavioral skills. This theory is said to be moderately effective in promoting behavioral change. Munro et al. 2007. Reflection. Cultural understanding of the human body. It can be difficult to understand the functions of a healing practice without also being aware of the rationale upon which the practice rests. Different understandings of how the human body works should and do lead logically to different ways of fixing it. It is therefore useful briefly to consider some of the different cultural metaphors for understanding the workings of the human body. Perhaps the most widely held view is that which refers to the notion of balance and imbalance in the body. According to the concept, the various systems within a healthy body are seen as being in harmony. Imbalance causing illness can result from physical, psychological, nutritional, environmental, or spiritual influences that trip this balance. The humoral theory is an example of a balance metaphor. This theory was developed into a systematic account of disease by Hippocrates and subsequently elaborated upon by Galen in the 2nd century BC, spreading throughout the Roman and the Arab world. Self-regulatory perspective or theory is the main theory in this domain, developed to conceptualize the adherence process in a way that refocuses on the patient. The theory proposes that it is necessary to examine individual subjective experiences of health threats to understand the way in which they adapt to these threats. According to this theory, individuals form cognitive representations of health threats and related emotional responses that combine new information with past experiences. These representations guide their selection of particular strategies for coping with health threats and consequently influence associated outcomes. The theory is based on the assumption that people are motivated to avoid and and treat illness threats, and that people are active, self-regulating problem solvers. Munro et al. 2007. Theories of illness. Let us now take into consideration some theories of illness. Theories of naturalistic causation. Theories of naturalistic causation will imply any theory, scientific or popular, which accounts for the impairments of health as a psychological consequences of the some experience of the victim in a manner that would not seem unreasonable to modern medical science. 5 distinct types of theories which fall into this category are mentioned in the following pages. इसको फिर से देख लेते हैं. Let us repeat this. Theories of naturalistic causation. Theories of naturalistic causation will imply any theory, scientific or popular, which accounts for the impairments of health as a physiological, not psychological, physiological consequences of some experiences of the victim in a manner that would not seem unreasonable to modern medical science. 5 distinct types of theories which fall into this category are mentioned in the following pages. Type 1 infection, defined as an invasion of the victim's body by noxious microorganisms, with particular but not exclusive reference to the germ theory of disease, deriving from the discoveries of Pasteur and Koch, Murdoch et al. 1998. Type 2 stress, defined as exposure of victim to either physical or non-physical strain such as overexertion, prolonged hunger or thirst, debilitating extremes of heat or cold, worry, fear, or the emotional disturbances which constitute the province of modern psychiatry. Murdoch et al. 1998. Type 3 organic deterioration. Defined as decline in physical capacities attending the onset of old age or the earlier failure of particular organs such as the heart or kidneys, or the appearance of serious hereditary defects often manifest at birth or in childhood. Murdoch et al. 1998. Type 4 accident, defined as the suffering of some physical injury under circumstances which appear to exclude both intentions on the part of the victim and suspension of supernatural interventions. Murdoch et al. 1998. Type 5 overt human aggression, defined as willful infliction of bodily injuries on another human being, as in violent quarrels, assault, or mayhem, broils, crimes of violence, warfare, and even attempted suicide, so called aggression turned inward. So now we can say that in naturalistic causation, illness is explained in impersonal terms when the body is in balance with the natural environment, a state of health prevails. However, when that balance is disturbed, illness results. Often people invoke both types of causation in explaining an episode of illness, and treatment may entail two corresponding types of therapy. In India, the ancient system of Ayurveda is based on naturalistic ideas of illness causation. Therapy in Ayurveda includes a vast pharmacopoeia of preparations made from herbs and minerals, and dietary advice also forms part of every prescription. Ayurveda is actively practiced in India today and has shaped the ways Indian thinks about their bodies in health and illness. Theories of supernatural causation. Theories of mystical causation may be defined as any theory which accounts for the impairments of health as the automatic consequence of some act or experiences of the victim, mediated by some putative impersonal causal relationship rather than by intervention of a human or supernatural being. Four specific types of causation fall into this category. Murdoch et al. 1998. They are fate or personified ill luck, ominous sensations, contagion, mystical retribution, spirit aggression, sorcery, and witchcraft. Fate is reported as one of the major detriments of illness. Ill luck being ill luck bring untold miseries, which makes the person to believe that some unseen power or spirit have been controlling his life and bringing ill luck. Ominous sensation refer to experiencing of particularly potent kinds of dreams, sights, sounds, or other sensation believed to cause illness. Disease may also be caused if one comes in contact with a polluting object, substance, or person. Contagion. A disease caused by mystical retribution implies breaches of appropriate behavior towards kinsmen, strangers, or superiors, or towards the supernatural or violation of some taboo. Diseases are often believed to be caused by the malevolent actions of some hostile and aggressive spirits or supernatural beings. Spirit aggression is often reported as the predominant cause of illness in many societies. Besides the above mentioned disease causing factors, it is pertinent to note that disease may also be caused due to the covert action of an envious affront an envious, affronted, or malicious human being who employ magical means to injure his victims. Such actions to inflict diseases may be performed either through sorcery or witchcraft. Murdoch et al. 1998. Supernatural or personalistic disease causation theory thus attributes illness to causative agents which are considered to be intelligent beings. This theory is particularly common among most non-Western societies. Even if a person may know that mosquito bite cause malaria, he or she often thinks and believes that cause of the illness is due to the power and evil work of such agents as evil spirits, sorcerers, witches, ancestor ghosts, curses made by elders, wrath of supernatural beings, etc. Emotionalist causation theory states that illness occurs due to some intense negative emotional experiences. A number of ethnographic studies have found out that there are, for example, mental illnesses that are unique to certain cultural settings. Pilgrims 2000, Skupin and D. Course 1995. Such emotionalistic disease that result from particular environments and cultural tradition may be termed as culture bound syndromes. Howard and Dunave Hattis 1992. In some cultures, emotional experiences such as anxiety and fright may cause an illness called susto, or what is also called soul loss. In anthropological literature, a person who is believed to be caught with these physiological illnesses may develop symptoms such as lethargy, tiredness, or weariness, inactivity, vaguenesses, distraction, or thought disturbances, etc. In Ethiopia, which is predominantly a traditional society, traditional non scientific explanations of diseases are very important in diagnosis, treatment, and management of disease. Belief in the power of various intelligent agents such as guineas, Mitchell, Satan, Gainel, Buddha, etc. to cause different psychological and physical ailments is very common in most cultures in the country. Jerry Hun 2001. People in some cultures do not go to a modern healthcare center to seek help for certain types of disease. Read 1996. The views of disease causation people hold thus are very important in determining the people's healthcare seeking behavior and types of diagnosis and treatment. That is why it is crucial for healthcare professionals to be culturally sensitive and to have some basic understanding of socio-cultural anthropological knowledge when dealing with the care of patients from different cultural and religious backgrounds. Hellman 1984, Galanty 1997. Thank you very much.